Welcome back. We are going to continue with walking. We're towards the end of our walking series, and we are going to discuss the swinging of the opposite leg. So we kind of been talking about what happens when you stand on one leg, you hit the strike, you get to the mid stance, and then you toe off. Well, what happens now when that foot comes up and goes through? So let's look at that. Okay, so now, as we're walking, now we get back to toe off and we're push off phase. Now we want to bring this leg through. First, we get a little bit of muscles working in the front. Our knee has to be able to bend, so our hamstrings are a part of that. And then our toes and foot have to come up to get us ready for heel strike. Same thing now on the opposite side, a little bit of bend at the hip. The hip comes forward because it was just extended, our knee bends. Now we're going to put our heel down, but our toes and our foot have to lift up to make that happen. So as you can see, there's a lot that goes into it. So there's a lot that can go wrong, especially if certain areas of our body are tight, or if certain areas are overused, or if we can't feel certain areas. So some of the common things I see during swing phase is maybe the knee doesn't bend, so a person will swing their leg out to the side. I see that common in injuries. Sometimes people walk and they keep their whole knee bent and they don't allow themselves to have a full heel strike. So there's a lot of different things. Sometimes, as we talked once before, is they lift their toe up too much to put the heel down and they keep that toe up, and it leads to blackened toenails from the pressure. So there's a lot of different issues that happen in that swing phase. We want to let our hip relax as much as possible so it can go from that extended position and start to bend as your knee bends and then your foot comes through. So again, we go from an extended position back here in our hip, and then it must start to bend forward as our knee comes forward, our heel comes and hits the ground as our foot came forward. It's a whole process. And so sometimes when people are stuck in their patterns, I'll have them march and exaggerate. And then once they've done that a little bit and found out which muscles tire, then we know some of the issues that they're having. And it helps to be able to address and to sense which muscles are not working, so then we can work on that and get their walking pattern a little bit more smooth. All parts of the walking pattern are so important, and this coordination is very critical to allow you to walk in a fluid manner that allows you to walk for a long period of time. The most critical thing that I see is that people overuse their back. The position of their trunk and their pelvis really impact how they walk. So as soon as that chest comes out, shoulders back, and the pelvis goes forward, I see less use of the lower legs. I see less use of the thighs, and it becomes problematic. And it's harder for you to swing your leg through and really get a good reach when your back is turned on. As soon as that drops down, all of a sudden it's so much easier to create a pendulum right at the hip and allow the leg to go back and to allow it to go forward. All of this, the magic of walking, takes a lot of coordination, a lot of looking at what's happening, what muscles are working, which ones are compensating, which ones are not working. It's a fine little art. So if you have questions, please reach out to me. These videos are designed to help you become aware of some of the things to think about with walking and to assess yourself and get help from people. I hope this was useful. Please reach out to me if you have questions. Amy@paberinstitute.com, PABRinstitute.com, AMY. Please reach out to me. Have a great week. We'll see you again next week. Take care.